Dr. Bandile Hadebe, spokesperson for the Africa Health Conference, now joins us to discuss this a bit more further, and he joins us via our telephone line. Bandile, thank you so much for joining us here on the late edition. Of course, today was indeed the first day of the Africa Health Conference, which kicked off in Midrand. Please, if you could just give us a bit of insight, how did day one go in terms of the discussions that were underway?
Good evening, Bandile. Good evening to your viewers. Day one was actually quite successful. And it started off with the cutting of the ribbon and opening the exhibition area, visiting the more than 1,000 exhibitors that have descended upon South Africa. And we're seeing close to 1,000 delegates coming through this year, close to 10,000, more than 10,000 delegates coming through this year. Which is a significant growth from our last conference, which was sitting at about north of 6,000. So we're looking at more than 4,000 odd additional delegates having descended on Africa today. And really today was more about the CPD-related conferences that are dedicated towards professionals, which are focused on continuous professional development, which are structured by our scientific committee and come with accreditation, which is a requirement in the profession. We also saw the public health summit being, the main conference of the day, with a very packed room of public health specialists and professionals across the board standing on that session. And we had a very lively, environment with delegates interacting, with business interacting, with potential clients and future partners. And that's really what the platform is about. It's about creating this melting pot for everything healthcare.
And perhaps maybe if you can also just share with our viewers when it comes to the importance and the significance of this conference. I mean, it's a conference that, transcends throughout the continent, looking at solutions for healthcare. Just tell us, why is it so important for us to have a conference of this magnitude on the African continent?
So there's many facets that actually point right. One of them is we really have created this conference as a platform for healthcare leaders to just pause and apply strategic thinking, which often is not the situation throughout the year because of the nature of healthcare. It's such an urgent, crisis-laden, fast-paced environment where you almost always have to make a decision on your feet. So what we're doing with Africa Health and Africa Health Indaba is just press pause and allow our leaders to be taken away from their regular environment and sit in this conference amongst each other and think strategically about where to take their different divisions, about where to take their different countries, and about where to take the full continent. So that's the first part. The second part is we want to create a platform that looks at healthcare as an economic driver, not just as a crisis, but as an economic driver, because we're talking about a $12 trillion industry globally, which we are only taking $90 billion of that. So with our 1.3 billion population, we are not claiming what we should be claiming from the health economy. And so within this calmer, strategic, happy environment where healthcare leaders, healthcare providers, and professionals and academics have not been used to, are now able to think slightly differently and say, how do we actually drive Africa's competitiveness? So that's the second point. But also what we are really trying to drive it is, how do we get as close as possible across the continent to the true version of universal access to healthcare? How do we drive that as an overarching paradigm, not from a country perspective or a provincial perspective, but from a continental perspective? How do we look at our available skills, our available resources from a continental perspective? So that's the overarching vision. Everything else that happens underneath Africa Health is really building blocks to this macro vision of a better South Africa utilizing healthcare as a catalyst for that future.
And Dr. Bandile, tomorrow we understand that you'll be holding your first Africa Health Indaba. You know, when it comes to what this means for the continent, perhaps maybe give us an insight there. You know, it's the first ever you're holding this Indaba. What can we look forward to there?
Yeah, so Africa Health as an overarching congress has been in the running for 13 years now. And that's really been focused on the exhibitions and these academic conferences. With Indaba, we're now adding this leadership platform where we are inviting ministers, CEOs, industry leaders within the healthcare environment from across the continent and from other parts of the world to sit under one room and reimagine what Africa could look like and what role we could play in that situation. And we're not just calling healthcare players because we understand that there's an ecosystem that we need to build on. So you've got ministers of entrepreneurship, you've got ministers of international affairs, you've got ministers of home affairs. On top of all the ministers of health and deputy ministers of health, we've got special advisors to president from Ghana, from Egypt, coming into this session to really shape this conversation around where healthcare should be going. You've got group CEOs of massive hospital groups. You've got, payers of insurance, medical insurance coming into the room, pharmaceutical manufacturers coming into the room. So everyone who's a significant player in the healthcare conversation is coming to this Indaba to really shape that vision. And we think we're starting on a very high tone for the very first one, which is obviously setting us up on a very good trajectory for the subsequent sessions of Indaba to really drive that African vision of where we're going with healthcare, not just as a crisis, but as a strategic economic driver.
And Dr. Bandile, obviously, when it comes to conferences, there's usually recommendations the conference comes up with or resolutions. You know, who will you be taking these resolutions to? Are you working hand in hand with the African Union, to try and implement these resolutions on a greater scale and, ensure that it is indeed the people on the continent who benefit from this conference?
Certainly. So one of our strategic outcomes from the conference is to establish a biannual journal that has got strategic frameworks, standards, norms, case studies for how certain things within healthcare are done, and that will be published twice a year, looking at all the different situations across the continent that we're looking at. If you scan through the program, we've reached out to entities like the Africa Free Trade Area, we've reached out to NEPAD AUDA, we've reached out to other international bodies like the Global Fund. We are reaching out to those entities as part of the launch so that the outcomes of these conversations are then taken back to them. So for instance, with the Global Fund and the likes of USAID, we want to get to a situation where some of the conditions that are put in place for funding given to African nations are quite restrictive. How do we drive a continental conversation that seeks to correct the situation while we need the support, but some of the conditions that come with that support makes it quite difficult to actually do what we need to do with those funds. And so we're reaching out to those entities and saying, look, we like the support, but can you tweak the conversation here? Can we do this differently? Can we use our own in-country regulatory bodies for this particular component so that we are not subjected to entities like FDA when we've got similar entities within country that can actually do similar work and at a lesser cost? So there is an intention to have an outcome booklet, an outcome strategic document that is shared amongst the countries, that is shared amongst the continental bodies and drive that thought leadership within where we're going in the context of healthcare.